COVID-19 is a new virus that was first found in December of 2019 in China and has now spread to the United States and specifically the state of Maine. This virus affects everyone no matter what their race, gender, age, and religion. This presentation provides some information and recommendations from the United States Center of Disease Control and Prevention and the Maine Center for Disease Control and Prevention. COVID-19 spreads by person-to-person contact. This virus is spread between people who are in close contact with one another, within about 6 feet, by the respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. People are thought to be the most contagious when they are the sickest. Some spread might be possible before people show signs of symptoms or realize they have been infected. Also, it is possible to get COVID-19 by touching a surface or object that has the virus on it, and then touching your own mouth, nose, or possibly your eyes. Older adults and people who have severe medical conditions like heart or lung disease or diabetes seem to be at a higher risk for developing serious complications from COVID-19 illness. Please consult with your healthcare provider about additional steps you may be able to take to protect yourself. Take steps to protect yourself by washing your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Also, avoid close contact with people who are sick by putting distance between yourself and other people because COVID-19 is spreading in the state of Maine. This is especially important for people who are at a higher risk of getting very sick. Contact your healthcare provider to have extra needed prescribed medications. Have over-the-counter medications and medical supplies to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. Have enough household items and groceries on hand so that you will be prepared to stay at home for a period of time. Take steps to protect others by staying home if you are sick, except to get medical care. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash and immediately wash your hands with soap and water for at least 20 seconds, or use hand sanitizer that contains at least 60% alcohol. Clean and disinfect surfaces that are frequently touched, such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water first, and then clean them with disinfectant. If you are sick, you should wear a face mask when you are around other people and before you enter a health care provider's office. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers. Call your doctor or health care provider for medical advice, regardless of immigration status. If you think you have been exposed to COVID-19 and develop a fever and symptoms such as a cough. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed COVID-19 cases. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, bluish lips or face. This is not an all-inclusive list. Please consult your medical provider for any other symptoms that are severe or concerning. The following information is specific for the state of Maine. Healthcare organizations like hospitals and community health centers are required to help people regardless if they have health insurance or the ability to pay. Interpretation services are available. The test for COVID-19 is performed by Maine's Public Health Laboratory for free. Anyone uninsured in Maine is encouraged to find out if they are eligible for coverage options like MaineCare or free care programs at the hospitals, which provides comprehensive health coverage at low or no cost to enrollees. Maine residents and organizations are prohibited from having any gatherings of more than 10 people until further notice, except for work. Some examples of prohibited gatherings are social and community events, such as weddings, personal, faith-based, such as churches, mosques, and temples, sports, clubs, fundraisers, fairs, and festivals. Anything that could happen in theaters, large conference rooms, or meeting halls are prohibited, for example. All restaurants and bars have been ordered to stop dining in services. Restaurants and bars are allowed to provide takeout, carryout, and drive-through services. The suspension of non-essential group gatherings and business can help Maine limit the spread of the virus here. Social distancing is very important. Slowing the spread of COVID-19 will reduce the burden on our healthcare system. For more up-to-date information, please visit the United States Center for Disease Control and Prevention's website or the Maine Center for Disease Control and Prevention's website. Also, you can call Maine's 211 option to get answers to questions about COVID-19 at any time. This service is available by dialing 211 or 1-866-811-5695. Texting your zip code to 898-211 or emailing info@211maine.org. Interpretation is available.